fact, while you're so relaxed, I want you to lift your arm, and you'll find that it just feels good. I want you to lift that left arm. Just lift it up, and just notice how easy it is to lift and put in any position, and you'll have no discomfort at all. You can lift it way up, any position, nothing will bother, nothing will disturb. That's right, and you just won't feel it. Just move it any way you want, and you can raise your hand above your head any way you want. That's right. Now, and you'll be able to do that afterwards, too, without any discomfort at all. And the more you practice it, the more you'll get mobility into that area, and the quicker you'll help yourself recover. So I want you to practice moving that arm occasionally, and you'll feel that relaxation in that arm at all times. Now, when I have you open your eyes, notice how good you feel. All right, open your eyes. That is the way I would give the suggestions for it, and you'll find that you can get rid of the pain. They'll still have the bursitis, but you can then treat them, and you can give them the necessary medications and so on, the necessary treatments, but you'll find that they are pain-free. They won't be symptom-free. Now, that's a different thing. They'll still know that they have the bursitis, but it will not be a painful thing to them. In fact, one of the first write-ups we ever got in Cosmopolitan magazine, the work of my students, one of the doctors there tells about the many times he's used it in bursitis cases. And this is the way it was used to give him that success. Now, suppose you had to give an injection in the knee, for example. It's an orthopedic situation, and would you close your eyes again, please? Suppose you had to give an injection now in the knee area. And I want you to send that relaxation all the way down to your toes. Now, I'll have to be working in that knee area. Nothing that we do will bother or disturb you. You'll know that we're working there. Now, I'll have to be doing I'll have to put some medicine in that knee. And it won't bother you at all because you'll be so relaxed when I do it that you'll be able to tell I'm working there. But that's all you'll be able to tell about. And nothing will bother, nothing will disturb. Now, doctor, at this point you could go ahead and you could give a knee injection, and they wouldn't feel it. Now, perhaps the man who could tell you more about foot injections, and because he works with that area of the body continually, and he can tell you how much relief from discomfort he gets by injections and so on. Doctor, how often do you use that technique, would you say?
Oh, quite a bit.
How's it work for you?
Very well.
Very well. It works.
Of course, I would be going ahead, but I've used placebo methods.
Yes, of course. Well, there are other methods as we go along that they're not aware of yet. But right now, they could do that work in these first 2 weeks, and without any discomfort at all. Now, when I have you open your eyes, you're just going to feel wonderful. Now, open your eyes. But that's the way you would do it. Thank you so much. How do you feel?
Right.
Good. Friends, I have been very, very delighted with the way that you have taken to this. And I really mean that. I mean that we've had a good group of men from beginning to end. And each man apparently has understood what he's to do and does it very well. Remember that once you have the patient in the suggestible state, words have terrific impact on them. Therefore, stay away from all words such as knife, needle, sharp, incision, stitches, cut. Anything that engraves a pain image on their mind, stay away from it. In other words, I feel that the doctor who does away with certain words from his vocabulary will get along with his patients a lot better. I'll talk to you more about that as the course continues. But right now, I want you to see what eliminating the words hurt and pain does for you in your practice for the next 2 weeks. Just eliminate those words, whether you're using hypnosis or whether you aren't. And all of a sudden, you'll find that there's a better relationship. You don't use the word pain, and you'll find that the patient doesn't have so much pain. Don't use the word hurt, and the patient won't hurt so much. Doctors, without realizing it, implant pain images on the minds of their patients. And then the patients, being tense, tend to magnify the picture. And what should be a minor procedure becomes an almost major one, simply as a result of the doctor's incorrect use of words. Now, friends, what you did tonight, practice tomorrow. Start practicing the first thing. These records which are going to be given to you with your outlines, you aren't supposed to memorize them. I don't think there's a student of mine that memorizes them. If they do, they're doing the wrong thing. But that they should memorize the thinking behind the words, oh, yes. Memorize the thinking. Now, let me show you the impact already of what we're doing, how it hit two men tonight, and both men instantaneously realized that almost at you might say, below the level of conscious awareness, that the wording they had used was wrong. One of the men used the word hardly. You won't feel bad at all, hardly. And immediately afterwards, say, yeah, I wanted to erase that. Who was that? Was that you? Was that you that did that? And then I think it was you later who said you won't have a bad memory of this at all, which is, and you realized how incorrect it was even before I told you, didn't you? Now, you're going to find yourself becoming more and more aware of the words you use as you study this subject, and you'll find that not using those words even when you don't use this subject helps you considerably. When you see the difference it makes in your practice, you'll be delighted. Now, friends, I want to spend a little time teaching you something that I think is awfully important, and that is autosuggestion. Now, all hypnosis is auto-hypnosis, and auto-hypnosis is autosuggestion. So that when I teach you autosuggestion, I am in reality teaching you how to hypnotize yourself. If you can get these effects on other people, certainly you ought to be able to get them on yourself. For example, if I want to have painful medical work done, or dental work, I don't let the doctor use anesthesia on me. I will tell him, doctor, I can anesthetize myself. I don't need any help from you. In fact, I've got better anesthesia than you can give me. And immediately I will proceed to give myself a suggestion, and I will have complete anesthesia. Now, when I tell you that I have had 6 gingival cavities prepared and filled, and I think the dentists here can tell you that deep gingival cavities are usually pretty troublesome. And I didn't feel any more than if they were working on somebody else's shoes. I've had a growth removed from my face that the doctor thought might be troublesome, and he wanted to send a biopsy, he wanted to have a biopsy taken and all that sort of thing. And he told me I'll have to go very, very deep on this one. And so he said, you better have anesthesia for this. And I said, no, doctor, I can give myself better anesthesia than you could possibly give me. And after it was all over, the man said to me, I don't know how it is possible for you not to have felt more than you felt. He says, don't you have feelings? I said, yes, I knew you were working there, but I just didn't let myself feel it. Now, I have also had a rectal abscess opened. And those of you who are in medicine know that that's one of the most difficult areas of the human body to anesthetize. And I've had the proctologist say to me afterwards, Mr. Elman, don't you have feelings? Don't you feel anything? How did you do that? I've never seen such good anesthesia in my life as what you get. And all I did was to give myself a suggestion. When I say to you that I want you to be able to do the same thing, I am not fooling. I want you to be able to do the same thing. The sad part of it is, in my teaching career, that there are men who take this course who do not learn autosuggestion the way they should learn it. And there isn't anything I can do about it. I show you how to do it. You're able to do it in class, and then you don't practice it at home, and then when you need it, it isn't there. Now, anything that's valuable is certainly worth practicing. And the only way you're going to be able to get it on a permanent basis, that is to practice it. Anesthesia is not the only thing you use autosuggestion for. For example, many of you men in medicine and dentistry work awfully hard. those last few patients at the end of the day, when you just wish you didn't have to see any more people, when you'd like to have the pep you had in the morning, then you just give yourself a suggestion, green, 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 and you are just as peppy as you were in the morning, and the last few people are as easy to treat as the first few. But after the last patient leaves the office, or after you leave the hospital and your work is done and nature says that you don't need the suggestion anymore, then with a dull thud, you come back to your natural self, and brother, you do feel the difference. There's no doubt about it. Another way that you can use it is for getting rid of headaches, aches and pains. Women who are troubled with dysmentaria, get rid of the dysmentaria. Suggestion will do it. Any aches and pains, even organic aches and pains, you'll be able to alleviate. You'll never mask the symptom, but you'll be able to alleviate it. You can even get rid of a toothache, but you'll know the toothache is there, but it won't hurt so much, and you'll know that you should go to the dentist. But it will be alleviated. You'll be able to bear with it. Headaches and everything like that. In so many different ways, you'll be able to use autosuggestion if you learn it. Now, what is the procedure for the autosuggestion? It's just this. I use a cue word. I use the word green. Why do I use the word green? Well, any student of semantics knows that the word green connotes the pleasantest visions in the minds of the most people. God made the world to be green. So I just take a pleasant word like that. But if you don't like the color green, if you don't like the word green, you can use any word. You could use cigarette case, tape, glass, water. Anything would accomplish the same thing. But I use the word green, and I think that you'll find that the word green is very valuable to you if you use it like this. Now watch, I'm going to give myself dental anesthesia. I say the word, and simultaneously I close my eyes. Green. Now I test to make sure that I cannot open my eyes, because I too must bypass my critical factor in order to establish the selective thinking. Now I want the anesthesia to come on this side. So I just stroke it a couple of times to let my mind know where to think. Now, I say that word the second time and the anesthesia comes right in. Green. And I can just feel that anesthesia come right in there, and I can feel it just get stronger and stronger and stronger. And now I want to be so strong when I open my eyes that a dentist could work on that side of my face and I wouldn't feel a thing. Green. And now, brother, I have anesthesia right there. I can feel it. I don't know whether it's visible to you or not, but I can actually feel the anesthesia there. Now, I want that anesthesia to go away. I don't need it any longer. I say green, 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 and it's gone. Let me show it to you another way. I can put that anesthesia any place in my body that I want. I've been working on that arm with this side of my hand the last few classes, so now I'm going to work with another side of my hand. I'll work with this side of my hand tonight. I want to give myself a suggestion, for example, that I won't feel those Alice clamps. Now, gentlemen, tolerance is one thing, anesthesia is another, and I'm not talking about analgesia. I am talking about anesthesia, where you don't even feel anything. And that thing could be left there for minutes and minutes, and you wouldn't notice it. Could be left there for maybe 3 or 4 or 5 or 10 minutes, and you wouldn't feel it. Now, how do you give yourself such a suggestion? Well, here's the way I do it. Green, and my eyes are locked. Now, I want this area to be so anesthetized that I don't feel a thing. So I say green. And now I don't know how numbness feels in that area, so I know that I just won't feel anything in that area. That's the idea. And I just let the hand go limp. Then I say the third word because I want that no feeling to be complete so that I can use the Alice clamps on it without feeling it. So I say green. Now I know that I can close those Alice clamps and I won't feel a thing. And I don't feel a thing. I can swing them around, I can do anything. You try that with a little piece of skin in there, and if you haven't got anesthesia, brother, you won't tolerate it very long. But I could tolerate it, and afterwards I don't feel it. Why? Because included in that suggestion was the idea that afterwards I wouldn't be able to feel it. Now, I wasn't kidding you. There's the... And if you don't think those things are tight, feel them. They are tight. They're plenty. They're the same ones I used on you. And you know that they're tight, isn't that right? But I didn't feel it. It didn't even amount to analgesia. It amounted to anesthesia is what it amounted to. In other words, I couldn't tell that I had it on this hand or this hand. That's what I mean by anesthesia. I mean perfect anesthesia. I want you to learn autosuggestion. Let's see if we can't anesthetize the first time through. All you have to do is to believe it's going to happen, and it will happen. There's one thing you should not do. Don't try to make it happen. In other words, don't say to yourself, I've got to try so hard. Because you don't have to try so hard. You don't have to try at all. All you've got to say to yourself is, look, if other people can do it, I can do it. I know it's going to happen. And when you believe it's going to happen, it happens. Now say that I'm going to show you how to anesthetize yourself the first time through. Say the word green and lock your eyes. Green. Just say that word and lock your eyes. Test, make sure that you can't open your eyes. And you too, doctor. Now, relax all the way down your body, just the same way as you would have anybody in your patient's chair. Relax. Now, I want you to stroke the area that you want to anesthetize. I don't care what area you want to anesthetize, anesthetize it. And don't choose an area of the body that you don't know what anesthesia feels like, because then you won't know whether you've got it or not. Choose an area where you know what anesthesia feels like. Now, say the second word and watch the anesthesia come right in. Green. Now, feel that anesthesia come in stronger and stronger and stronger. Now say the third word and that anesthesia will get so strong when you open your eyes that a doctor could work on that area and you wouldn't even feel it. Now say that third word and open your eyes and you'll have the anesthesia. Green. Now open your eyes. Now raise your hand if you've got it. You got it. If you got it? How's it feel? Feels like you got it. Is that right? Raise your hand, those who've got it. Will you please? You got it? Yeah. How about you back there? You got it? Have you got it, doctor? Yeah. Well, you will have a sense of feeling, but because you can never get away from the sense of touch. But the idea is, if you got anesthesia there, can you feel anesthesia in that area? I mean, can you feel numbness in that area? You can. Well, then the chances are you've got it. How about you, doctor? Have you got it?
Yeah, this side's already done. This is just like that.
Good. Oh, okay. And how are you doing, doctor?
I used my nose, and I believe I was satisfied that I came, when you said, say green again, I was coming back out. Then when I got it, I felt it.
Yeah. But now...
I thought I really differentiated pretty sensitive.
Yeah. Oh, that nose can be... That
you
can...
said green there, I was doing a pretty good job of pinching.
Yeah.
And when I come back out, well, I quit.
Yeah. Okay, let's try it again, because some of you got it, some of you didn't. I want all of you to get it. I'll tell you what, let's do this. Let's everybody take the jaw, because I think that if we all take the jaw, we know what dental anesthesia is like, and once you can establish dental anesthesia, you can just say, well, now my earlobe is going to feel like that, or now my hand is going to feel like that, or my arm, or my bottom, or my shin, or my ankle, or whatever it is. But you know what anesthesia of your jaw is, so let's try for that first and get it. Let's say the first word and lock our eyes. Green. Now lock your eyes. Now stroke that jaw that you want to anesthetize. Now you want that anesthesia to come right in, and you want it to come in solid. So say that second word with a full knowledge that the anesthesia is going to pour through there. Green. Now you'll feel that anesthesia coming right through there, and let it come through there strong. Now you want that anesthesia to get so strong when you open your eyes that a doctor can work there and you wouldn't feel it. So say that third word, open your eyes, and you'll be anesthetized completely. Green. Now open your eyes, you'll have it. Now we ought to have a lot of people with it. Raise your hands, those who've got it, will you please? 1, 2, 3, you've got it. There's a 4, you 5, 6, Did you get it back there? You didn't get it. You got it, though. Is that right? Did you get it? 6, 7. How about you, doctor? You got it this time? How many of the doctors did not get it that time? Will you raise your hand, please? 1, 2. Well, you see, gentlemen, look. Already, those who did not get it are in the minority. Wait a second. Did I see 3 hands go up? Did anybody up here that didn't get it? You didn't get it. 1, 2, 3. There was 3 that didn't get it. 3 that didn't get it. Now, gentlemen, already you are in the minority because you see that the others have got it. So, I don't want you to try for it. When practicing isn't trying for it. Because all you've got to do is to believe it's going to happen, and it'll happen. You see, if you don't believe it's going to happen, it won't happen. Sure, when you really get it, you're so proud of it that you hold on to it. Because, sure, you'd be surprised. I've had doctors come back a week later and say, my jaw was anesthetized all this week. And I said, well, why didn't you take it away? He said, well, I don't know, I was just so glad to have it and know that I could do that. But to know that anesthesia is available at your command, not when the doctor says, I got to anesthetize you, but when you say to yourself, well, I got to have some painful work done this afternoon, I don't want to feel it, I better anesthetize myself. And then you go up to the dentist's office or the physician's office, and you don't feel anything he does to you. I tell you, it does give you a feeling of pride, gentlemen. It gives you a wonderful feeling of pride. Let's say that first word and lock our eyes, and let's see if every one of us can't get it this time. Don't try for it. Those of you who didn't get it, don't try for it. Just say to yourself, if the others got it, I can get it too. It'll happen to me just the same as the others, and you'll have it. All right, say the first word, green. Now, stroke the jaw that you want that anesthesia in. Now you want it to be so strong now that a doctor can work on that area. So just say that second word, and that anesthesia will march straight down into that jaw. Green. Now you can feel it going all through that jaw. And just imagine you can feel it, and all of a sudden it won't be imagination, it'll be real. Now you want to say that third word with the idea that the anesthesia is going to be stronger than any you've ever known in a dentist's office. And gentlemen, you can have it that way. You can have it stronger than any anesthesia you ever had in the dental office. Think of it that way and watch when you open your eyes how it'll be. You'll all have complete anesthesia. Now say the word green and open your eyes, you'll have it. Green. Now open your eyes and you'll have terrific anesthesia. Now, how did it come? Is it coming in this time? Is there a threshold change? How are you doing, doctor? How's yours? It's coming in a little bit now. All right, now look. 2 got threshold changes out of the 3 that weren't getting it. The rest of you got it all right, I guess, didn't you? You got it all right. You got it all right. Didn't you?
I'm not real sure.
Well, the best way to make sure, doctor, is tests. And you'd be surprised how tests will do wonders for you. Because now, don't test one against the other, doctor. That's the world's worst way. That puts the critical factor right back in focus. You're criticizing the instant you say, I wonder if this jaw feels different than this jaw, and immediately you feel things equally, and the critical factor comes back. Your critical factor has to be out of focus when you do this. You can see the scientific reason for it, can't you? Now that I pointed out to you as to why you shouldn't test. We've got testing instruments. And the best way to test for anesthesia is to test for it. Let's have one of the dentists come over and make a test over here. Will you please? You might be amazed to find that you've got it. You don't have to make much of a test.
Question there. If you had me that way, and you keep my eye, I got that way now, where we want it. And you say, now just let your eyes remain closed and place it open, and then approach me on a test. Wouldn't I be better off?
I don't know. I don't think that eyes closed or open make a lot of difference at this point. To get a class which is absolutely unanimous in getting autosuggestion the first time through is a rarity, and the fact that every one of you did it is proof of the fact that it can be done. But just because it came easy to you tonight, and it did come awfully easy to you, don't think that it will remain easy with you if you don't practice. Now, a strange thing about autosuggestion is that you can be wonderful at it here. And yet, if you don't believe you can make it work elsewhere, you won't be able to make it work elsewhere. That's why you must practice it so as to be able to make it work anywhere in the world. It takes about 4 seconds to anesthetize yourself. Do you realize, doctor, that all you did was to just stroke your jaw for a couple of seconds, and then he made his test? That's all that happened. And you got a reasonable degree of anesthesia that very first time through. He shook your head with that test. And yet it didn't make you want to say ouch at any time, did it?
No, I was satisfied.
Sure. Now, if it had hurt, you would have hollered just like anybody else. But the fact of the matter is that you got it because you said to yourself, I'm going to get it, like everybody else. And everybody got it, and you got it. But now here's the funny thing about autosuggestion. If you don't practice it, you don't keep it, unless it becomes a conditioned reflex like it has with me. You see, when I want to give myself anesthesia, I just know it's got to happen. I just say to myself, well, it always has happened. Why shouldn't it happen this time? And it happens. But if you still have your doubts about being able to do with it, those doubts will loom larger and larger, and then when you want it, autosuggestion isn't available to you. Now that you know you can do it, practice it. Practice it. In other words, it takes 4 seconds to go through the entire modus operandi. So why shouldn't you say to yourself, green, 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 about 50 times a day? You want anesthesia here, so this time you put it in the left jaw. Now you want anesthesia on the right jaw. Now you want anesthesia on the nose. Now you want it on the earlobe. Now you want it on the hand. Now you want it on the other hand. Practice doing it, gentlemen. And you would be surprised within 2 weeks. You will become so adept with autosuggestion that you wouldn't sell your knowledge of autosuggestion for $10,000, and I'm not fooling. Because once you're able to do this, you are so proud of being able to control your body with your mind that you just believe it is a priceless possession. You can't help but feel that way because every man who's ever learned autosuggestion feels that way about it. I have had letters from doctors who have taken just one session, just as you have done, and then something has come up and they needed the autosuggestion and it worked. And I have their letters of gratitude saying that, thank God I came to your class before I needed this particular anesthesia. And then they will tell me some terrific story about how they were able to put anesthesia to work. In one of my early classes, the doctor told me this story. He says, I am a polio victim. And he says, I've been a polio victim since I was about 14 years of age. I'm in dentistry. I have to stand on my legs all day. Every once in a while, my knee has a habit of going out of position. He says, it isn't very strong, as you can well imagine. And he says, working on it all day, about twice a year, it just goes out of position. And when it does, I have to cancel all appointments for 2 or 3 days while I'm waiting for my leg to be able to support my body once again. So the other night, I was sound and fast asleep, and I woke up with a start, and apparently I had moved in some way, and I had thrown the leg out of position, and the pain was absolutely unbearable. And I said to myself, if what Dave Elman taught me about autosuggestion is right, I ought to be able to control that knee with autosuggestion. Green, green, green. And he says, I give you my word, that knee went right back into position. I said, I don't know what caused it, but I woke up my wife because I was so excited that I was able to use autosuggestion that way. And Mr. Elman, I didn't have to cancel my appointments the next day, and everything has been going beautifully. So you learn to use autosuggestion for everything under the sun. Now, oh boy, I've kept you late tonight, but remember, this has been our first session, and we do have more than the usual number of enrollees.